everyone, and welcome back. Today, we're going to be taking a deep dive into the world of double lung transplants.
Okay.
And let me tell yes, the source material we've got is fascinating. It's like a crash course
Uh-huh.
designed for medical students prepping for a major exam.
Yeah.
So think scalpels, sutures, and second chances at breathing freely.
It's definitely a high-stakes area of medicine, that's for
Oh,
sure.
absolutely. You're literally giving someone a new lease on life.
Yeah.
So, okay, right off the bat,
Okay.
this description of a clamshell incision totally caught my eye.
Mm-hmm.
They basically crack open the chest like a treasure chest, right?
Well, it's a bit more complex than that, but
Okay.
essentially, yes. The clamshell incision is a large horizontal cut across the chest.
Okay.
It allows surgeons to access both lungs at the same time.
I see.
It's the standard approach for a double lung transplant because you need to remove both of the patient's diseased lungs
Yeah.
and then carefully replace them with healthy donor lungs.
That's some serious surgery. And then the source mentions 5 intercostal drain site scars.
Right.
5. That sounds intense.
Those drains are crucial for recovery.
Really?
Yeah, imagine fluid and air building up in the chest after surgery.
Oh, no.
Not good.
Yeah.
These drains help remove that excess stuff,
Okay.
allowing the new lungs to inflate properly and preventing complications.
So it's like giving the new lungs space to breathe.
Exactly. And each drain leaves a small scar, hence the 5 you mentioned.
Makes sense. You know, one thing that really struck me was that the example patient in the source didn't need supplemental oxygen after the transplant.
Right.
I mean, that just seems like such a good sign that those new lungs are really doing their job.
Absolutely. It means the transplant is working well and the patient can breathe on their own.
Wow.
That's the ultimate goal. But it makes you wonder, how do doctors decide who gets a lung transplant in the first place?
Yeah, because it's not like everyone with lung problems qualifies, right?
It's a very selective process.
Yeah.
Think of it like this. You have to be sick enough to desperately need new lungs,
Okay.
but healthy enough to actually survive the surgery and the long road of recovery.
I see.
It's a tricky balance.
So walk me through it.
Sure.
What are the actual criteria?
There are 3 main ones.
Okay.
First, the patient needs to have a very high risk of dying from their lung disease within the next 2 years without a transplant.
Oh, wow.
So it's a life or death situation.
Yeah.
Essentially, yes. But the second criteria is that they need a good chance of surviving at least 90 days post-transplant.
So not too frail.
Right. So they can't be so frail that they wouldn't make it through the initial recovery.
It's that delicate balance you were talking about.
Yes.
Sick enough for the transplant,
Right.
but strong enough to recover from it.
Exactly.
What's the third criteria?
Doctors look at the likelihood of the patient surviving for at least 5 years after the transplant,
Okay.
assuming the new lungs function well. This considers their overall health,
Mm-hmm.
any other medical conditions they might have,
Gotcha.
and their support system.
That makes sense. You need to make sure that the new lungs will actually make a long-term difference in their life.
Exactly. It's about maximizing the benefit for the patient.
So what are some of the common conditions that actually lead to people needing lung transplants?
The ones that come up most often are interstitial lung disease,
Mm-hmm.
cystic fibrosis, COPD,
Okay.
and pulmonary vascular diseases.
Now, I'm curious about why they sometimes do double lung transplants instead of single.
Okay.
Is it just a matter of how many lungs are available from the donor?
That's a great question.
Yeah.
And it's more complicated than just organ availability.
Okay.
Survival rates are actually significantly higher for double lung transplants.
Really?
Yes. We're talking a median survival of 7.4 years
Yeah.
compared to 4.6 years for a single lung transplant.
Wow. That's a much bigger difference than I expected.
It is.
So when did they go for the double?
It really depends on the individual case.
Okay.
Sometimes even with conditions like COPD or interstitial lung disease,
Mm-hmm.
a double transplant might be a better choice,
Okay.
especially for younger patients,
Nice.
or if they have secondary pulmonary hypertension.
So it's not a one-size-fits-all approach.
Not at all.
Okay.
Each patient is unique,
Mm-hmm.
and the medical team needs to weigh all the factors to decide the best course of action.
Let's say you've had the transplant, you're breathing with new lungs, but the journey isn't over.
Right.
What does recovery look like?
Recovery is a big deal.
Yeah.
One thing that really stands out is the lifelong commitment to immunosuppressant medications.
Correct.
These drugs prevent the body from rejecting those brand new lungs.
So the body doesn't try to fight off the new lungs like there's some kind of invader?
That's it. The source material specifically mentions a combination of prednisolone,
Uh-huh.
a calcineurin inhibitor like tacrolimus,
Okay.
and a nucleotide blocking agent.
Are there any other medications involved?
Yes, besides the immunosuppressants, patients also need prophylactic medications to prevent opportunistic infections. Think about it. Their immune systems are suppressed,
Yeah.
so they're more vulnerable to getting sick.
Makes sense.
Yeah.
So are there downsides to these medications, like side effects?
Unfortunately, yes.
Mm,
Long-term use of prednisolone can lead to a Cushingoid appearance,
okay.
which basically means a redistribution of fat.
I see.
It can also cause things like weaker bones, thinner skin,
Oh, no.
and even diabetes.
Oh, wow.
And tacrolimus can contribute to diabetes and tremors, especially if the drug levels get too high.
It sounds like a real balancing act, you know? Needing these drugs to survive, but also managing the potential side effects.
You've hit the nail on the head.
Yeah.
It's a challenge for both doctors and patients.
I bet.
But hey, at least you're breathing, right?
Right. Okay, besides those medication side effects, what are some of the other scary things that can happen after a lung transplant?
Well, rejection is a major concern.
Yeah.
There's hyperacute rejection,
Yeah.
which happens almost immediately after the transplant.
Oh, wow.
It's rare, but very serious.
Oh, geez.
Like the body is saying, nope, not having these new lungs.
That sounds terrifying.
It is, but thankfully it's not common.
Okay.
Then there's chronic rejection,
Mm-hmm.
which develops over time.
Okay.
It's often caused by something called bronchiolitis obliterans syndrome,
Okay.
or BOS for short.
Okay.
It causes inflammation and scarring in the small airways of the lungs.
And that can lead to...
It can lead to respiratory failure and even death.
Oh, wow.
It's actually the leading cause of death after that first year post-transplant.
Really?
And the incidence increases to almost 50% by 5 years.
So even if you make it through that initial period, there's still long-term risks.
Unfortunately, that's the reality of transplantation. There are
Yeah.
always challenges to face.
And we can't forget about infections, right?
Right,
You mentioned that transplant recipients are more susceptible to them.
exactly. Those immunosuppressant medications are lifesavers,
Mm-hmm.
but they also make patients more vulnerable to all sorts of infections,
Right.
from bacterial and viral to fungal and mycobacterial. And these infections can get very serious.
It seems like a lot can go wrong even after a successful transplant.
That's the reality. But it's important to remember that lung transplantation can also be life-saving
Yeah.
for people with end-stage lung disease. It's a complex decision with a lot to weigh.
Yeah, I can imagine.
Yeah.
Okay, so we've talked about who might be eligible for a transplant,
Right.
the different types of transplants, the medications, and
Yeah.
some of the complications.
Mm-hmm.
Is there anything else that would like completely rule someone out from getting a transplant? Like, are there deal breakers?
You mean contraindication?
Yeah, those. What are some of those?
Well, there are absolute contraindications, meaning you absolutely cannot get a transplant if you have them.
Okay.
For instance, recent history of malignancy.
Mm-hmm.
If you've had cancer in the past 5 years, you wouldn't be eligible.
Makes sense. They don't want to give you new lungs if the cancer might come back. What else?
Another one is untreatable issues with other organs,
Huh.
like your heart, liver, kidneys, or brain.
Oh, wow.
Unless you're getting a multi-organ transplant, of course.
So they need to make sure all your other major systems are in decent shape.
Right.
Okay, what about something like smoking? I feel like that's got to be a no-go.
You are absolutely right. Active substance abuse, including smoking, is a definite deal breaker.
Yeah,
If you're not willing to take care of your health, they're not going to give you a new set of lungs.
right. That seems pretty obvious. What are some of the more surprising contraindications?
This one might surprise you. Mental health conditions that would prevent you from taking your medications regularly or attending clinic appointments are also an absolute contraindication.
Really? I guess they need to make sure you're able to handle the demanding post-transplant regimen.
Exactly. And lack of a social support system is another one.
That makes sense. You need people to help you through the recovery process and beyond.
Right.
So are those all the absolute contraindications?
Those are some of the big ones. There are also relative contraindications, which might make you less likely to get a transplant, but aren't automatic disqualifiers.
What?
Things like age over 65, a BMI over 30, severe malnutrition, severe osteoporosis, or the presence of resistant organisms in your system.
Wow. This is a lot to consider.
Yeah.
So when should someone even be referred for a transplant evaluation? When do those conversations even begin?
The timing really depends on the specific lung condition, but earlier is usually better.
So don't wait until you're on death's door.
Right. The source material mentions that for interstitial lung disease, which has a particularly poor prognosis, any patient with usual interstitial pneumonia or fibrotic NSIP, which is a specific type of interstitial lung disease,
Okay.
Should be considered for referral if they don't have any contraindications.
Wait, so even if their lung function is still relatively okay, they might still be referred for a transplant evaluation?
It's about being proactive and not waiting until it's too late.
What about for other conditions?
For cystic fibrosis, patients are typically considered for referral when their FEV1, a measurement of how well your lungs are working, drops below 30%.
Okay.
And they have other complicating factors like poor exercise tolerance, pulmonary hypertension, or a history of pneumothorax, which is a collapsed lung.
So for cystic fibrosis patients, that low FEV1 is like a red flag that their lung function is seriously compromised?
Yes, it's a sign that their disease is progressing.
Okay, what about people with COPD?
COPD is the most common reason for a lung transplant.
Oh, wow.
And for those patients, doctors often use the BOD index to help determine who might benefit most from a transplant.
What's the BODE index?
It's a scoring system that considers body mass index airflow obstruction, how short of breath someone is, and their exercise capacity.
Okay.
A higher score means a worse prognosis.
So a high BODE index means you're more likely to benefit from a transplant.
That's the idea.
Mm.
It helps doctors identify the COPD patients who are most likely to see a real improvement in their lives after a transplant.
This is all incredibly fascinating, but also pretty overwhelming. It seems like there are so many factors to consider.
It's true. Lung transplantation is a complex and life-altering decision for both the patient and their families.
All right, we've covered a ton of information here. I'm curious, what are some of the key takeaways for our listeners? What do you really want them to remember?
I think the biggest takeaway is the criteria for eligibility. It's not just about being sick.
Right.
You also need to be healthy enough to actually survive the surgery and the long-term recovery.
It's that tricky balance we talked about before, right?
Right.
What else?
It's important to be aware of the different types of lung transplants and why a double lung transplant might be preferred over a single. And of course, even though lung transplantation can be life-saving, it comes with its own set of risks and challenges.
All the medications, the potential for rejection, the infections. It's a lot to weigh.
Absolutely. And that leads me to a question for you to consider. Given all these risks and benefits, how do you think the decision to pursue a lung transplant should be made? What factors would matter most to you?
That's a great question to think about. And for anyone who wants to dive deeper, I'd suggest looking up the BODE index or reading more about some of the specific lung conditions we mentioned today. There's a whole world of information out there.
It really is a complex decision with no easy answers.
Yeah.
It makes you appreciate the difficult choices that patients and their families have to make when facing these kinds of health challenges.
It does. And I think it also highlights the incredible advancements in medical science that have made lung transplants even possible. It's amazing to think that we can give someone a new set of lungs and a second chance at life.
It's pretty remarkable.
Yeah.
And it's not just about extending life, it's about improving quality of life, too. Imagine being able to breathe freely again after years of struggling to catch your breath.
Speaking of breathing, you mentioned earlier that patients with cystic fibrosis are typically considered for referral when their FEV1 drops below 30%. Can you remind us what FEV1 is and why that number is significant?
Sure, FEV1 stands for forced expiratory volume in 1 second. It's basically a measure of how much air you can forcefully exhale in 1 second. It gives doctors a good idea of how well your lungs are functioning.
So lower FEV1 means your lungs aren't working as well as they should be.
Exactly. And for cystic fibrosis patients, an FEV1 below 30% is a big warning sign that their lung function is declining and a transplant might be necessary.
We've talked a lot about the medications transplant recipients need to take, like immunosuppressants to prevent rejection and prophylactic medications to prevent infections. But I'm wondering about the long-term implications of being on these medications for so long. Are there any downsides?
That's an important question. As you mentioned before, these medications, especially the immunosuppressants, can have some pretty significant side effects. Long-term use of corticosteroids like prednisolone can lead to weight gain, high blood pressure diabetes, osteoporosis, and even cataracts.
Wow, that's a lot of potential problems. It seems like a bit of a catch-22. You need the medications to survive, but they can also cause new health issues.
It's definitely a balancing act, and the calcineurin inhibitors like tacrolimus can also cause kidney damage and high blood pressure, as well as increase the risk of certain types of cancer.
So it's a constant challenge for both doctors and patients to manage the risks of rejection and infection while minimizing the potential for long-term side effects from the medications themselves.
You got it. It requires careful monitoring and adjustments to the medication regimen over time. It's a real team effort between the patient and their medical team.
The source material mentions that patients with COPD and idiopathic pulmonary fibrosis tend to have poorer 10-year survival rates than those with cystic fibrosis and pulmonary hypertension. I'm curious, why do you think that is?
That's a complex question, and there isn't one simple answer. But it could be because COPD and idiopathic pulmonary fibrosis are often diagnosed later in life when patients might already have other health problems that could complicate a transplant and their recovery.
So they might be going into the transplant in a more fragile state of health.
Exactly. And those other health issues could make them more vulnerable to complications after the transplant. It's like a house of cards. If one thing goes wrong, it can trigger a cascade of problems.
What about cystic fibrosis and pulmonary hypertension? Why do you think those patients tend to have better long-term survival rates?
Well, with cystic fibrosis, patients are usually diagnosed when they're younger, so they might be in better overall health when they need a transplant. And they often receive very specialized care throughout their lives, which could lead to better outcomes after a transplant. They're used to managing their condition and working closely with medical professionals.
That makes sense. What about pulmonary hypertension?
Pulmonary hypertension is serious, but it mainly affects the blood vessels in the lungs. So the rest of their lungs might be relatively healthy, which could be a factor in their better prognosis after a transplant.
It's amazing how the underlying condition can have such a big impact on the outcome of a transplant.
It's a great example of why personalized medicine is so important. Every patient is different, and their treatment needs to be tailored to their individual circumstances.
Okay, let's switch gears a bit and talk about those contraindications we discussed earlier, the things that would prevent someone from getting a lung transplant. Some of them, like recent cancer or active substance abuse, seem pretty straightforward. But others, like mental health conditions or lack of a social support system, feel a bit more nuanced. Can you unpack those for us?
Of course, remember, a lung transplant is a major life-altering surgery with a long and demanding recovery. It's not just a one-time event. It requires strict adherence to a complicated medication regimen, regular follow-up appointments, and significant lifestyle changes.
Right, it's a huge commitment.
Exactly.
Mm.
And that's why mental health and social support are so crucial. If someone is struggling with a mental health condition that makes it hard for them to manage their medications or attend appointments,
Mm.
it could really increase their risk of complications and even jeopardize the success of the transplant.
It's like you need to be in the right headspace to handle all the challenges that come with a transplant.
That's a good way to put it. And then there's social support. Recovery from a lung transplant is both physically and emotionally challenging. Patients need people around them who can help them navigate the ups and downs, provide practical assistance, and offer emotional support.
I can imagine it feeling pretty isolating and overwhelming at times.
It definitely can be. Without a solid support system, patients are more likely to struggle with sticking to their treatment plan, experience depression and anxiety, and have a lower overall quality of life. They need people they can lean on.
So it's not just about the patient's physical health, it's about their mental and emotional well-being too, and their ability to handle the demands of a transplant.
Precisely. The transplant team takes all these factors into account when evaluating a patient for a transplant. They want to make sure the patient is set up for success in all aspects of their life.
Okay, I'm starting to get a much clearer picture of all the complexities involved in lung transplantation. We've covered the eligibility criteria, the different types of transplants, the medications, the potential complications, and the contraindications. Is there anything else our listeners should know about this incredible field?
I think it's important to remember that lung transplantation is a rapidly evolving field. New techniques and technologies are constantly being developed, which is improving outcomes and making transplants possible for more people. It's an exciting time to be involved in this area of medicine.
That is encouraging.
Yeah.
So, what does the future hold for lung transplantation? Any cool advancements on the horizon?
One area that researchers are really excited about is the development of artificial lungs. These devices could potentially act as a bridge for patients waiting for a donor lung, or maybe even become a permanent replacement in certain cases.
Wow, artificial lungs. That sounds like something straight out of science fiction.
It does, right? But it's closer to reality than you might think. There are already clinical trials underway to test the feasibility and safety of these devices.
That's incredible. What about xenotransplantation? I've heard about the possibility of using organs from pigs for human transplants. Could that be a viable option for lung transplants?
It's definitely an area that's being explored. Pigs actually have lungs that are anatomically pretty similar to human lungs. And there's been some promising research in genetically modifying pigs to make their organs more compatible with the human immune system so they wouldn't be rejected.
So one day we might be getting our lungs from pigs.
It's a possibility. There's still a lot of hurdles to overcome, but it's an exciting area of research that could potentially help solve the shortage of donor organs.
That would be a game changer for sure.
Absolutely. And beyond those technological advancements, there's a big push to improve the long-term outcomes for transplant recipients. Researchers are working hard to develop better immunosuppressant medications with fewer side effects, and they're also looking for ways to prevent and treat complications like rejection and infection.
So it sounds like the future of lung transplantation is pretty bright.
I believe so. With all the research and innovation happening, we can offer hope and a better quality of life to even more people with end-stage lung disease.
This has been an incredibly informative deep dive into the world of lung transplantation. I feel like I've learned so much.
Me too. It's been a great conversation.
Before we wrap up, are there any final takeaways you want to leave our listeners with?
I think the main takeaway is that lung transplantation is a complex and multifaceted decision. It's not just about the surgery itself, but also about the long-term commitment to medications, lifestyle changes, and ongoing medical care.
Right, it's a life-changing choice with both risks and rewards.
Exactly. It's really important for patients and their families to have honest and open conversations with their medical team so they can make informed decisions about their care. They need to understand the full picture.
That's excellent advice. And for those who want to explore this topic further, I highly recommend checking out some of the resources we mentioned earlier, like the BODE Index and information on specific lung conditions. There's a wealth of knowledge out there.
Knowledge is power, as they say. The more you understand about lung transplantation, the better equipped you'll be to make informed decisions about your health or the health of a loved one.
Well said. This has been a fantastic conversation. Thank you so much for sharing your expertise with us today.
My pleasure. I always enjoy talking about this fascinating field.
And to our listeners, thank you for joining us on this deep dive into the world of lung transplantation. We hope you found it informative and maybe even inspiring. Until next time, stay curious. It really is amazing how far we've come in medicine,
Yeah,
what we can do now to help people with end-stage lung disease.
it's incredible.
We're talking about giving someone a whole new set of lungs.
It really is mind-blowing when you think about it.
Yeah.
And it wouldn't be possible without the dedication and expertise of the entire transplant team.
Yeah.
The surgeons, the physicians,
Uh-huh.
the nurses, the coordinators,
Yeah.
everyone involved. They are truly amazing people who are committed to giving their patients the best possible chance.
Absolutely. They're the real heroes behind the scenes.
Couldn't agree more. And speaking of heroes, we can't forget about the organ donors and their families.
Oh, of course not.
Their incredible generosity makes these life-saving transplants a reality. It's a beautiful example of humanity at its best.
You're so right. It's such a selfless act that can bring hope and healing to so many people. Okay, before we wrap things up,
Okay.
I wanted to circle back to something we talked about earlier.
Yeah.
The clamshell incision.
Hmm?
It sounds pretty intense.
It's big surgery.
Yeah. Can you walk us through what recovery is actually like after a double lung transplant?
Sure. After the surgery, the patient spends several days in the intensive care unit where they're closely monitored for any complications.
Okay.
They'll be on a ventilator to help them breathe,
Mm-hmm.
and we'll have various tubes and drains in place.
That's a pretty critical time.
Definitely. But as they start to heal,
Okay.
they'll slowly be weaned off the ventilator and the tubes and drains will be removed.
Gotcha.
They'll also begin physical therapy to regain their strength and get moving again.
How long does it typically take to recover from a double lung transplant? I imagine it's not a quick process.
It varies from person to person,
Mm.
but most patients spend several weeks in the hospital.
Wow.
Once they're discharged, they need to continue with pulmonary rehabilitation
Okay.
and have regular follow-up appointments with their transplant team. It can take several months to fully recover and adjust to life after a transplant.
It sounds like a long road,
It is.
but hopefully one that leads to a much better quality of life.
That's the ultimate goal, to give patients a chance to breathe easier and live life to the fullest.
We've covered so much ground today.
We have.
From the intricacies of the surgery itself
Mhm.
to the profound impact organ donation has on so many lives. But I keep coming back to this idea of hope.
Yeah.
Lung transplantation offers hope to people with end-stage lung disease who might have very few options left. It's a chance to start over in a way.
That's beautifully said.
Yeah.
It offers hope not only to the patients,
Yeah.
but to their families and loved ones as well.
Right.
Imagine being able to see your loved one breathe comfortably again,
Yeah.
have more energy,
Yeah.
and simply enjoy life after years of struggling. It's a
Yeah,
powerful thing.
it really is. And I think that's the perfect note to end on.
I
A
think
note
so.
of hope and possibility. Thank you again for being here
Oh, it
today
was my pleasure.
and for sharing your incredible expertise with us. It's been such an enlightening conversation.
It has.
And to our listeners, thank you for joining us on this deep dive into the world of lung transplantation.
Yes, thanks for listening, everyone.
We hope you found it informative and maybe even inspiring. Until next time, stay curious.